Okay, item 13 this morning is an update on COVID-19. Public Health Administrator again. You've got your crew with you.
Yes, Madam Chair and Commissioners. Got the A team here, so, well, those two are the A team. Let's see, we'll start our PowerPoint. Let's see. Okay, so as we look at the numbers, we haven't been here for a few weeks, and we are seeing a little bit of an increase, but we want to say that this increase was not, it was expected. In fact, Minnesota Department of Health has been expecting an increase sometime this summer, so it was predicted before we even saw the numbers. So you can see in Clay County, just the week of the 10th through the 16th, we had 29 new cases. The next week, we had 70 new cases, so we did see an increase then. And our preliminary number, all the data isn't in yet, for the 24th through the 30th of April is 81 at this point. And again, this isn't alarming. This was really, we expected with variants. They change. And we know that they're going to, and we expect, as Minnesota Department of Health claims, it's going to ebb and flow. So we'll see some changes that cases may go up, and then we'll see cases go down again. It's hard to predict with this variant. It's because it's always going to change. The big message, of course, as we look at cases and what we've always preached is get vaccinated. That's the best way we can deal with variant strains that change. In Minnesota, you see the new cases also increased from the 10th through the 16th. It was 5,443. Then they went up the following week to 7,388. Preliminary numbers so far is only showing 5,572. Again, they're preliminary, so we know that may increase, but we don't know to what level. So in Cass County, we're also seeing some increases over there, the 9th through the 15th, 76 cases. The next week they had 123. The following week, 175. So they're also seeing a little bit of an increase. And North Dakota is seeing an increase as well. These are the weekly cases by date of test. So you can see again, we started this graph October of 21. So you see the number of cases. You saw the large increase that we experienced in January, and then the decline and, staying low for a while, and now just a slight increase that we're experiencing in April. Antivirals. We talked about antivirals in the past. This is treatments that are typically given in the first 5 days that someone has an infection. And really, antivirals will help people that have health conditions that may make it difficult for them to get through, the infection. So those kind of at higher risk would really be the great candidates for an antiviral medication. It does need to be prescribed by a provider. And then the antivirals, we checked with some pharmacies locally, and they do have the oral antivirals. So we have Paxlovid, those for 12 plus, and Molnupiravir, something like that. That one is 18 and over, and those are the oral medications. Again, provider needs to write a prescription for that, and then those can be taken at the pharmacy. The IV infusions, the remdesivir and the monoclonal antibody infusions, the remdesivir, it's an IV infusion 1 day for 3 consecutive days. So it's a little bit more concentrated. That again needs a physician prescription and a physician, your primary care provider needs to recommend that you have that IV infusion. It's fairly costly, so that would be something that they would discuss with you. And the FDA now approved for children under 12 who are at high risk for disease as well. So that one can be recommended for those children. And this is really to prevent hospitalizations and worse. So it's really for really high-risk people. Monoclonal antibody infusion is the 12 plus. and that's an IV infusion, and that's the one option that seems to be most effective against the BA2 strain.
There's a couple questions, Commissioner Ebinger.
Yes, I'm trying to make sure I don't have this confused with something else. But on the oral pills, was this not maybe the CDC, but one of the federal agencies recommended it be used more often because there had been a shortage of them early on, and now they had more than were being prescribed? This is something they encourage both providers and people to ask for if they believe they had COVID.
Yeah, Madam Chair and Commissioner Ebinger, that is correct. There was a shortage for quite a while, and so they were really giving it to the ones that were really at the highest risk. Now there seems to be a plenty amount of these oral antivirals. So again, the providers will discuss with each individual whether they recommend that they receive that or not. That's correct.
Commissioner Campbell also had a question.
Yeah, thank you. So, but it's important for example, somebody who's high risk, if they have symptoms, to get tested right away. And if they have that positive test, they need to notify, or they should notify their medical provider right away. Because after 5 days, some of these things are much less effective, if effective at all. Isn't that correct?
That's correct. The most effectiveness is within the first 5 days. So if they can get this medication to individuals within the first 5 days of that positive test, absolutely.
Thank you.
All right, keep going.
Okay, Becky?
Good morning. So we do remain in touch with our local healthcare systems about COVID, and so we did receive a few updates from them yesterday, as shown here on the slide. So all in all, really seeing positive trends across the board as hospitalizations remain manageable. They have seen a slight uptick in the number of COVID inpatients recently, but are well within their capacity to handle this increase. So earlier in the year, as Kathy mentioned, during the Omicron surge, antiviral treatments were hard to come by. They were in short supply. There were long waiting lists. Fortunately, this is not the case anymore, and so our local healthcare systems have an ample supply of these treatments on hand as needed for their high-risk patients. So one thing they're really encouraging is that anyone that is at high risk for severe disease, to make sure that you're up to date on your vaccinations and receive that second booster when you're eligible. So that should really help cut down on hospitalizations as we see this small uptick of cases.
Any other questions on that piece?
And then this slide shows the number of new hospital admissions per week for Clay County residents, starting in 2021 up until last week. So as we move into a new normal with COVID, hospitalizations will become one of the most important indicators that we're looking at for the impact that COVID is having on our community. So we expect cases to ebb and flow, as Kathy mentioned earlier, and we may see slight increases in hospitalizations as we see an increase in cases. So you can see that we had several weeks without any hospital admissions, and now we are seeing a bit of an uptick. So two admissions per week the past couple weeks for Clay County. And then this graph shows the CDC map of community levels throughout Minnesota. The CDC has made a shift from their criteria that they used to use, and now they use more of a holistic and honestly more complicated metric to come up with or to evaluate the impact that COVID is having on a particular county. So these thresholds take into consideration hospitalizations and hospital capacity, as well as just case numbers. So as you can see, Clay County and surrounding counties are still at that low level of transmission. There are a few counties throughout Minnesota that are at that medium and high level.
In terms of moving forward with life, AC, after COVID, this seems to be an important indicator in terms of transmission, not only for COVID, but any other natural cold season, flu season. Is this something that you're hearing from CDC and within your public health circles, that this is something we'll see more of as we continue to gauge all different outbreaks of sickness?
You know, I haven't heard anything specifically to that. I think that this will become an important indicator to look more at just individual case numbers. We're really trying to move past that at this point in the pandemic or the endemic or whatever we're classifying this as now. So really looking at the broad impacts across the community versus just case numbers.
And I think it will be important. We've had crazy bouts with different strains of the flu virus that have been really scary as well, and I think it would be helpful to track that on a community wide map so people can see going forward.
And then this is the vaccine breakthrough report that MDH puts out every week, and then there's a side-by-side comparison of the past couple weeks. So about 10.6% of people in Minnesota that are fully vaccinated have wound up testing positive, which is what we call a breakthrough infection. So as you can see, hospitalizations and deaths remain extremely low among those that are fully vaccinated. These vaccines really are doing a remarkable job at keeping people out of the hospital and preventing deaths, even though we are seeing more breakthrough infections than we did with previous variants.
Questions? Commissioner Campbell?
I still want to, I always like this report, but I still want to also point out, I remember when the vaccines first came out, you were wondering, should you take Pfizer, should you Moderna, or the Johnson & Johnson, or whatever, but one of the things I've said from day one was that you might have, each of them were slightly different, but I think most of them were in around that 90% effective. So again, you see here, the 10% is, it shouldn't be a surprise because it was originally suggested that it's not going to work for everybody. However, you go to the next line, and the breakthrough cases when it comes to hospitalizations, you got a 99.7% chance of not being hospitalized if you've been vaccinated. That's a pretty interesting and pretty, it's pretty hard to argue with that statistic. So, you know, I've had my shots and my booster. I haven't had my second one yet, but I think I'm ready for it. But yeah, the evidence is pretty clear.
Yes, I agree.
So, thank you.
Okay, we'll move on to talking about vaccines and testing. So the first slide, the statewide vaccine data looks a little bit different, but as of 5/1, it's kind of showing you that light blue color is those that have had the first dose. The dark blue is those that have completed the initial series, and then the green is the booster. So just wanted to kind of point out that we are seeing a little bit of a lack of a response to those boosters, so want to continue to encourage people to take advantage of those when they're eligible. And then our highest, uptake on that vaccine is still that 65 and over, including the boosters, even though they're a little bit behind there. So yeah, that's the statewide data. And to go to the next slide, just to talk a little bit about the booster eligibility. So what we do post on our website every week when we list our clinics that you can register for. We also put who's eligible and the time frame for that. So it's on the county website. And then also, so who's eligible the first booster? That's anyone who's 12 and over and has completed that primary series can have that first booster. And then who's eligible for the second booster? Anyone who's 50 and over. And then anyone 12 and over with the moderate to severe immune compromised conditions. And then Johnson & Johnson, if you had the one first dose in the series and the second dose, that first booster, then you're encouraged that you could also have a second booster if it's been at least 2 months since your last one. So, and again, all of this information and the details of how many months between doses is on our website. So, I'm going to go to the next slide. I didn't even notice the boss left. Okay, then vaccines for children under 5, and then the boosters for that 5 to 11 is what we keep waiting for. So just wanted to share this information. Moderna has actually officially applied for that emergency use authorization as of 4/28. So they're asking to be able to serve that 6-month through 4 years of age. And then Pfizer is still working on that booster dose for that 5 through 11 that they are currently eligible for a primary series series for Pfizer, but they're working on that booster dose as well. And then the younger population, Pfizer's looking at that too, but looking at the number of doses that they would need for that initial series, if it should be 2 or 3. So the FDA has scheduled in June to be meeting with the ACIP, the Advisory Committee for an Immunization Practice. And so they're looking at these things in June, so hopeful that we will have a vaccine available for that 6-month through 4-year-olds, and then also a booster for the 5 through 11 coming soon. And this is just looking at what we've been doing for Clay County Public Health. We don't have our total, but we keep thinking that we're going to meet that 20,000, but we're just short of that. But a lot of vaccine that Public Health has been providing, but really just want to point out that we continue to serve clients every week. So this last week, which was through the 24th, the week of the 24th, we had 21 doses that we administered, and all of those were booster doses that week. And then it's just under 200 that we've done in all of April for public health at our Family Service Center. So then, go to the next slide. Okay, so public health clinics every Wednesday between 9 and 4, we hold a clinic for anyone who's eligible for a vaccine at any age. The only thing we haven't had is Johnson & Johnson. And so we continue to do that weekly, plus we are posting on our website who's eligible and when. They can register or they can call and schedule an appointment, and our number is up there for the clinic to call and schedule. But we also are not turning people away if they can't be seen on Wednesday. We invite them to come in for one of our clinic schedules. So most of the clinics are being handled by our clinic nurse. Cheryl is serving most of them, and she's there in the clinic, so we encourage them to come in if a Wednesday won't work. We try to get them in on Wednesday because of the fact that we end up wasting doses, but the state is saying there's more vaccine, plenty of vaccine. So they'd rather we were wasting vaccine than not serving someone. So you can call, schedule an appointment, and we're happy to serve you there as well. In April, we did do another Concordia clinic. We've been swinging through our universities to provide vaccine and boosters, and we did have a successful clinic in Concordia in April as well. And we continue to go work with corrections and with our long-term care. So the onesies, twosies, Cheryl is going to serve them as well. So, and then the next slide is on the vault testing site, and just kind of wanted to show how our positivity rate has kind of, gone up, our testing rate. And we do have our data. You have this. You guys have this? Yeah. So our data is showing us that even though we're not doing a lot more tests, we are seeing an increase in those that are positive that are coming through. So we're happy that we continue to have that vault test site available to us. Our positivity for the week of April 25th was 14.05%, and the week before, April 18th, it was 6.82%. So seeing the numbers, 337 for the week of the 18th and 363 tested, but what we're seeing is more positives are out there. And again, this is just a reflection of what we know in terms of testing, but there is a lot of self-testing out there, and those are not reported. But it tells us a lot when we look at what our positivity rate is doing. But again, not that that plays against our hospitalization, because our hospitals are handling those positive cases. So. And that's pretty much it, unless you have any questions about that.
Commissioner Campbell.
Not that I have questions. Well, my first question is, have we heard anything about the vault testing site and how long they plan to keep that open?
Kathy did just mention that, and I've forgotten. Do you know? Was it?
I believe she said we don't have a definitive close date for them, but they're thinking through June.
Okay.
Becky.
So maybe something just to keep in mind in the event that we're to close, what will be our plan of attack for testing? Some people have a little bit more confidence, for example, in the vault testing than the home test. And so what would be our plan? And do we need to be talking about what financial impacts that could have to our local public health department if vault is closed and we take over? Because we need to be ready for that if that were to happen. I don't expect answers to that today, but I think we need to be planning for that.
Okay.
Important. Anything else? All right. Thank you so much for your work,
you.
as always. We appreciate you. Okay, item number 14 this morning. Before you leave too, is I know our message to public health has been, feel the need to come whenever there's anything pertinent to share. Obviously, we're learning how to live with this, but for instance, if you hear that the vault site is closing or anything that we should be aware of, feel free to come back. Thank you.